Michel is with us with Michel Dental, and today we're talking about sleep apnea, which I find interesting coming from a dentist, but you have a lot of experience with this, right?
Dentists are becoming more involved in helping screen patients for sleep apnea because dentists a lot of times see patients more often than they see their regular physician through health history and oral exams. Sometimes those findings can suggest that maybe a patient has sleep apnea and it's something they should see their physician to have further diagnosed. Dentists also become involved with sleep apnea because the gold standard for treating sleep apnea is a CPAP device, and about 50% of those that are prescribed CPAPs are intolerant of them. So those that are unable to wear a CPAP, there are options, oral appliances, different designs, and companies that fabricate those. They're FDA-approved appliances specifically for sleep apnea. The dentists can place those. Now, it's important if you're having an oral appliance made, that you're having it made to the proper jaw position to help improve the airway. Because if the appliance isn't made to the proper position, you can actually make the sleep apnea worse rather than better. Now, some people may not have sleep apnea, but they have hypopnea, which is a significant reduction in the airway. And I brought along a little coffee straw.
Little stirs.
Right.
Yeah,
and so to demonstrate, or if you want to see what hypopnea is like, if you put that in your mouth and pinch your nose and just breathe in and out through that, that's about as much oxygen as people with hypopnea are getting.
Only while they're sleeping or all the time?
Yeah, but while they're sleeping.
And
some people may have episodes up to an hour or 2 hours with that decreased oxygenation, which that and sleep apnea can lead to cardiovascular problems, increased insulin levels, as well as daytime drowsiness. And there are a lot of motor vehicle accidents that are attributed to driver falling asleep at the wheel.
Mm-hmm. How do you know the difference between the two?
Well, it's testing that the physician would do.
Okay.
A patient, if it's suspected that they may have sleep apnea or hypopnea, they would have testing from a board-certified sleep physician who then would identify if they have apnea or hypopnea and what the best treatment for them would be. If a patient's intolerant of the CPAP, then the physician would write a script for an oral appliance.
I find that interesting. I didn't even know you could be intolerant to. I just thought that's what everyone got.
Some people are claustrophobic and having the device on different reasons they're intolerant.
Mm-hmm.
With the oral appliance, I think they find that about 80% of the population that is prescribed an appliance is tolerant of the oral appliance.
Okay. I'll just forget it's there. Is there anything that people need to look for to know if they should even bring this up with their dentist or hygienist?
Well, of course, daytime drowsiness. If your sleeping partner notices that you stop breathing at night, snoring can be an indicator of sleep apnea. However, snoring can also indicate that there is some air moving at that point. So you always become concerned when the individual stops breathing in their sleep. Sometimes patients or individuals will wake themselves up, and it's because they've stopped breathing and they have a startle effect to kind of get that breath started again.
Okay, scary. All right, if people want to reach you, how do they give you a call?
Our telephone number is 785-273-0801. We're at 2951 Wanamaker Drive in Topeka, and we also have an office in Silver Lake.
Which is very exciting, a new office in Silver Lake. All right, well, Dr. Michel, thank you.
Thank you.
Well, stay with us. We'll be